Hello, anatomy friends. This is Dr. Alsip. And in this first set of videos for this fourth portion of the course, we are going to focus on the bones of the thorax. So we have four learning objectives to work through in this video. So make sure you keep these in mind as we have our discussions. And the thorax is the region of the body between the neck and the abdomen. So that's kind of intuitive. We knew this already. Posteriorly, there are those thoracic vertebrae, but the thoracic cage, sometimes referred to just as the rib cage, that includes the ribs and their associated costal cartilages you'll see throughout, which they're going to be supported anteriorly by the sternum, sometimes referred to as the breastbone. And as you can imagine, the thoracic cage has a lot of functions. And probably the most intuitive one is protection of organs. That is going to be those organs of respiration, as well as the cardiovascular system. So the main things we think about are the lungs and the heart. But it's important to note that many of the organs in the abdominal cavity, like the liver, project superiorly and are protected to a certain extent by that inferior portion of the thoracic wall. So that liver is projecting up into this region a bit. The thoracic wall also has a role in respiration. With each breath, the intercostal muscles between the ribs and the diaphragm, which is extending up into this region, that changes the volume of the thoracic cavity. So the thoracic cavity can be expanded, it can be compressed. It will also resist subatmospheric internal pressures that are generated by the recoil of the lungs. Lastly, the skeleton of the thoracic wall, that also serves as muscle attachment points. So not only intercostal muscles, but you'll also have muscles of the upper limb that attach here, the neck, the back, and the abdomen. So a lot of muscles are attaching to this region. All right, so let's start talking about the individual bones, starting with the most anterior one, which is called the sternum. Although, again, colloquially, sometimes we refer to this as the breastbone, but we're in an anatomy class, so we're going to start calling them the correct names. It is generally palpable throughout much of its length. The xiphoid process is variable, sometimes it's not as palpable. And it directly overlies mediastinal structures. In particular, it's going to overlie the heart. And it can be subdivided into three parts. And these parts form cartilaginous synchondroses with one another, but will often develop into a synostosis or a bony joint in middle to late adulthood. So the three parts are going to be the superior manubrium, which is Latin for handle. So think of it as a handle to a sword, that the blade of the sword would be the body. The manubrium is the thickest and the widest part of the sternum. Then we get to the longest part of the sternum, which is the body, and its characteristic costal notches, or these kind of scallops on the sides, are really characteristic here. This is where we're going to have rib attachment, or specifically the costal cartilages of the ribs attach here. And the most inferior and variable portion of the sternum is the xiphoid process. So what do I mean in terms of variation? Well, the xiphoid process is almost always smaller than the other part, so that's not too variable there. But the xiphoid process can be curved. It can be curved a little bit inwards or a little bit outwards. It can be bifid or split into kind of two projections at the ends. It can be deviated a little bit to one side or the other. So there's a lot of variations that are seen here. Additionally, the xiphoid may not fully ossify until an individual is in their 40s. So there's lots of variability there. It is an important landmark, as it can help you understand the location of other structures that are going to be located deep to the bone. So some of those things would include the superior portion of the liver is about at that level, the inferior border of the heart, and the central tendon of the diaphragm all have some form of an association with the xiphoid process, but obviously on a deeper plane. All right, so let's move on to the major structures of the sternum and talk about some of the major landmarks or structures. And we will start with the jugular notch, sometimes referred to as the suprasternal notch. So if you are palpating in the neck and kind of move to the bottom of the neck, you should feel a divot right in that region, and that is that suprasternal notch. Uh, I want to point out that if you were to kind of go down a little bit further, you would be feeling an anterior projection right there, and that's going to be the sternal angle. So some things that are fairly easy to palpate in terms of an individual. So what you can do with this palpation is it gives you some bearings to understand some of the surrounding structures. For instance, the jugular notch is superficial to some pretty important structures, such as the aortic arch, as well as the trachea is even deeper to that. So that's all in that plane, that deeper plane. If you move lateral on either side of the jugular notch, there are going to be two notches that are articular sites for the medial ends of the clavicles, which will form the sternoclavicular joints, which are plain synovial joints that we will discuss more in some upcoming videos. In particular, how that is going to be associated with the upper limb. And then lastly, as I mentioned, if you continue your palpation exploration and you go just inferior to the jugular notch, you should feel a slight anterior projection. And this region right here is called the sternal angle. Sometimes you hear the angle of Lewis. And this is where the manubrium meets the body. So the actual more correct term is the manubriosternal joint because there is a joint forming right here. But most people, again, just say the sternal angle. And importantly, this angle is at the level of rib 2, which would articulate on the sides here. And knowing where rib 2 is can help count the other ribs. And that can help, say, in knowing where to put a stethoscope diaphragm to hear heart valve sounds. Similar to the jugular notch, this region can help you understand what structures are deep to this level. And so when we're talking about the sternal angle, deep to that would be the bifurcation of the trachea, so into those main bronchi, as well as the pulmonary trunk. All right, so now we are sternum experts, so let's move to the ribs, which are very closely associated to the sternum as we discuss. And recall from previous videos that all of the ribs are going to articulate with thoracic vertebrae. So don't forget that connection there. We talked a little bit about that in that previous video. There are going to be 12 pairs of ribs. These are flat, curved bones. Some of them are more curved than others, and they make up the majority of the thoracic cage. The majority of the ribs are actually spongy bone with, of course, that outer lining of compact bone. And within there is going to be blood-forming hematopoietic tissue. So an important area in terms of blood cell formation. There are three main categories of ribs, although I will note that not every rib is exactly the same. The most superior ribs, so this generally includes ribs 1 through 7, although there can be variation there. These are referred to as true ribs. And each one of these ribs will have their own costal cartilage that attaches to the sternum. And that costal cartilage is made up of hyaline cartilage. So they have their own individual costal cartilages. Ribs 8 through 10, although there may be some variability there, sometimes rib 7 kind of joins in with this category. These are referred to as false ribs. And the costal cartilages of these ribs do not go and directly articulate to the sternum. Rather, their costal cartilage will go and join with the costal cartilage of the rib superior to it. And then this kind of complex will then go and join with the sternum. And this complex of costal cartilages is going to be called the costal margin. And the costal margin is palpable. It's an important landmark in the body, particularly for understanding deeper structures. And remember that some of that abdominal viscera will extend up into this region as well. Ribs 11 and 12, sometimes 10, but you can just remember 11 and 12 for me, are considered floating ribs because while they do have generally a small rudimentary cartilage associated with it, that cartilage does not reach the sternum, so they do not attach to the sternum. Ribs 11 and 12 are considered atypical ribs because they are notably short. They do not have a neck or a tubercle like the other ribs. Rib 12 is generally the size of a pinky finger or a fifth digit, so quite small in terms. I honestly think this illustration makes it look a little bit longer than it typically is. Between a superior and inferior neighboring rib is a region called the intercostal space. So the intercostal space, they're not super wide spaces, but they're spaces nonetheless. And the intercostal space is named for the superior rib. So say for example, we're talking about the space between the fourth and the fifth rib. This intercostal space between the two is the fourth intercostal space. So named after that superior one. We will talk a bit more about the contents of this space in the muscles video, but this isn't an empty space during life. It's completely filled with muscles and neurovasculature. So a lot going on there. Before we finish our discussion of ribs, I do want to highlight an irregular rib, which is the very first one, ribs 1. Rib 1 is the broadest and the thickest. This is because it has more muscles attaching to it than its inferior counterparts. One of the most important of these muscles is the anterior scalene muscle. This rib is also often described as the shortest, although I would argue that rib 12 is quite short as well, but it's definitely the most sharply curved. Rib 2 is also comparatively curved to the other ribs, but not nearly as much as rib 1. And a portion of rib 1 is going to be deep to the clavicle, and then a good amount of it lies superior to the clavicle, which is different than all the other ribs. And so it's very closely associated with the neck region in addition to the thorax or that inferior portion of the neck. And whereas many of the other ribs are quite easily palpable, rib 1 is not easily palpable. So this is why you generally start counting ribs at rib 2 because you can palpate that sternal angle. You cannot palpate that rib 1 very well. Excellent. We have reached the practice question, and so let's return to the sternum with this question. The clavicle articulates with which part of the sternum? Pause the video, take as much time as you need, but when you're ready, I hope you have landed on B, the manubrium being the correct answer. So hopefully you're starting to feel comfortable with the landscape of this region. The clavicles, they're relatively superior structures here, so we need to be thinking of the most superior part of the sternum, which is the manubrium. The body of the sternum is important for having costal cartilages attaching to the sides, but clavicles definitely do not articulate here, and even less so with the xiphoid process. It is the most inferior portion of the sternum, so it's quite far from the clavicles, so not the correct answer. So we need to be going with that superior part of the sternum. The manubrium articulates with the clavicles, and the articular surfaces are called the clavicular notches for the sternum. Excellent. Thank you so much for your time and attention. It might be a good time to return to those learning objectives and gauge your understanding of these before moving on to the next video. Thank you for your time and attention.